I'm Dr. Aislinn Vaughan. I'm a breast surgeon who is board certified in general surgery and has done a fellowship in breast care. I'm the medical director for SSM Health Breast Care. My practice focuses on the care of patients with breast problems, and so certainly that does include breast cancer. That's a very well-known topic, of course. But I also see patients who have abnormal mammograms, if they have lumps in their breasts, if they have nipple discharge. A frequent reason patients see me now are actually family histories of breast cancer. There's a lot of genetic concern, there's a lot of media publicity about that, and I do genetic testing as well. But really the main focus of those visits is a risk assessment. But I see pretty much anything that's related to breast. Breast has evolved a lot in terms of how we take care of patients over the years. And we used to do pretty radical surgeries where you wouldn't have much choice of what we recommended. Now patients have a lot of choices when they see us in the office. And so we kind of go through the pros and the cons of the different options, why we recommend what we recommend. And then more and more recently, we're getting to where we can do less aggressive surgeries and still have just as good of an outcome. We can do things in a more cosmetically appealing way that still achieve the goal of treating the problem. And we are starting to be able to do things that are less uncomfortable for the patient in terms of how we get to that route. And so I think those are all huge advances that are being made in the care of our breast patients. I really believe that to be comfortable with dealing with things that are scary, which frankly anyone in my office is somewhat scared, is to have as much knowledge as they can about the problem so that they can then have a plan of how we're going to deal with this. And so I really believe in going through all the information and trying to keep it in lay language. I write everything down and go through it with them in writing because we know that patients can't remember everything we tell them. And so that way they have something in writing to refer back to, and we can even talk through things over the phone that way. And I really try to treat them like they're my mom or my sister and how I would like to be treated if I was in the office or if they were in somebody's office. And I think that goes a long way with patients. I think they see that.